Tijdens deze video nemen wij u mee bij uw eerste bezoek aan de RugNekZorg Kliniek van Dr. Joe.
Hi, I'm Dr. Joe. Welcome. There's some water to help release the toxins for your nieren and your liver. Peter, we're going to take a picture of your posture.
Op deze foto's kan hij door middel van speciale software duidelijk uw houding zien.
Omdraaien alstublieft. Like this. Okay, we take one more picture. Peter, these are the pictures I've taken of you that shows your houding. And your houding is alles.
Okay.
This shows the zwaartekracht, or the gravity, that we measure in newtons from Sir Isaac Newton.
Mm-hmm.
This shows you have a force of 18.5 newtons pushing down on you all day long, and that's affecting your neck and your shoulders as it's pulling you forward with about 10 kilograms of weight. So it's like someone's pulling your neck forward the whole time. My job is to correct the vertical column so that you have less pressure on it and there's less weight pulling you forward every day. Each person is different.
Okay.
So your spine is totally different from somebody else's. So we take you on an individual basis. This next photo that we took of you shows your neck vertils, and it's a really nice picture because you get to see what you look like inside. And this shows the zenuwen that are going out to your hands and different parts of your body. The slagader comes up and goes under the atlas and then into the brain here. This is where the hersenen becomes the zenuwstelsel. So this is you looking in a spiegel, and this is you looking at me.
Okay.
And my job is to very voorzichtig correct the neck and the atlas. I do not do any twisting of the neck. My technique is very voorzichtig. And I will very gently adjust the atlas, which will help your bloeddruk and will help the zenuwen as they control the milt and the maag and the dikke darm and the lever and the nieren and the maag. And that makes your body work a little bit better.
Chiropractie is net als de tandarts een preventieve geneeswijze. En met een bezoek enkele keren per jaar beschermt chiropractie uw wervelkolom en heeft u beduidend minder kans op lichamelijke klachten.
Usually in the beginning we like to see people 2 times a week for 2 to 4 weeks, and then 1 time a week for 2 to 4 weeks, and then 1 time a month for a couple of months. This is so that the vertils can stay in place, because my job is that we take the vertil and put it back in place so that you hold your adjustment.
Okay.
Most people's vertils are misaligned for years. We have them go back in place, and then the spieren will pull them back again.
Okay.
This is actually the disc that is in between your body. You could hold this if you want. It's made of a protein matrix called nucleus propulsus, and it actually supports the vertebrae, but it also feeds the vertebrae. The vertebrae are alive. Even though they're hard, they need food and they create waste. When the disc is uneven and it goes like this, it will actually press out one side and press on the zenuwen. Now that could affect your milt, your maag, your dikke darm, your heart, your liver, your nieren, and my job is to make sure that the vertical column has a correctie and that there's no pressure on the disc. If that gets to be too bad, you have to go to the hospital and they need to operate on that, which is very dangerous.
Na het bespreken van uw intakeformulier en uw persoonlijke houdingsanalyse neemt Dr. Joe u mee naar de behandelkamer.
If anything is gevoelig, please let me know. All of my techniques are very voorzichtig. I do not do the kraken of the neck.
Okay.
Okay? This is your atlas, the first bone of your neck. This is where the hersenen becomes the zenuwstelsel.
Okay.
Just think of me as a tandarts for the vertical column. I feel that you have a problem in your linker side on the 3rd and 4th vertil. So I will correct the vertils to take pressure off the slagaders, which supplies oxygen and blood to the hersenen. This is from the ongeluk, and the wervel has been misaligned for several years.
Tijdens uw behandeling zal Dr. Joe zeer voorzichtig met uw lichaam omgaan. Hij weet immers exact wat hij doet na zijn jarenlange studie in Amerika.
Okay, Peter, I'm just going to check your wervel column like the tandarts checks your teeth. If anything is gewuldig, please let me know. This is your lungen, and I can tell that the linker side is higher than the rechter side. So adem in and adem out, alstublieft, and aanspannen. Okay, nice and easy. Good. 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 And good. Okay? All right.
Iedere stap die Dr. Joe zet tijdens de behandeling zal hij aan u uitleggen. Zo wordt u tijdens de behandeling begeleid in het proces.
Peter, I'm going to check the 7 wervels in your neck. This is where your heart pumps blood and oxygen into your hersenen through your slagaders. I'm coming off the base of your skull, which is your occiput, and I'm going to the first bone, which is the atlas. This is your atlas, which is the base of your skull. I'm coming off the occiput into your atlas, and you have a problem with your linker side. You feel that?
Yes.
Okay. Adem in and adem out, alstublieft. Peter, I'm going to correct your linkse haupt. The table makes a little bit of a noise. It's just the table. Adem in and adem out. Nice and easy, it goes boom. Okay? Kunt u op uw rechterzijde gaan liggen, alstublieft?
Okay.
Dank u wel. I do all the work. You just relax. Adem in en adem out, alstublieft. En aanspannen. Okay. Okay. Good. Dat is alles. Any questions?
No, thank you.
Okay.
RugNekZorg Kliniek is aangesloten bij de Dutch Chiropractic Federation, waardoor alle ziektekostenverzekeraars vanuit een aanvullend pakket de nota van RugNekZorg Kliniek vergoedt. U heeft geen verwijzing van uw huisarts en of ziektekostenverzekeraar nodig om een afspraak te maken bij de chiropractor. RugNekZorg Kliniek Arnhem bedankt Paul Giesen voor zijn bijzondere support gedurende productie van deze educatieve video. Graag verwelkomen wij u op de Johan de Witlaan nummer 254 in Arnhem.